This is a technique video demonstrating a minimally invasive quadriceps tendon autograft harvest with a bone block, utilizing recently developed instrumentation in a patient undergoing primary ACL reconstruction. The patient is placed in the supine position on the operating table. The medial and lateral borders, as well as the superior and inferior poles of the patella, are marked. A 2 centimeter incision over the proximal third of the patella and distal end of the quadriceps tendon is made. Bursal tissue is then dissected and removed from the surface of the patella. Next, the plane between the quadriceps tendon and the subcutaneous tissue is developed. The central portion of the superior patella is then measured and marked to plan for harvesting the patellar bone plug. Next, using a 2 millimeter wide drill bit, a small pilot hole is drilled in the middle of the planned bone cuts using the easy-shaped bone plug guide. Once the guide is pinned in place, an ACL saw is used to score the patella 1 to 2 millimeters deep along the medial and lateral sides of the saw guide. Using the bone plug guide, a 30-degree angled cut is made. Once the first angled cut is completed, the instrument is rotated 180 degrees and an identical cut is made along the opposite side of the bone plug. The bone plug guide is then removed from the pilot hole and a transverse cut is made to finalize your bone plug harvest. The bone plug guide is then removed along with the bone plug from the patella with a forceps to ensure adequate harvest without complications. Passing suture is placed through the hole in the bone plug, which was created with the initial pilot hole using a 2 millimeter drill. Next, the Vera blade, which is a dual scalpel instrument, is used to score the quadriceps tendon with 2 vertical cuts, aiming for a depth of 5 millimeters. The width of the Vera blade device is set to match the desired width of the quad tendon and is inserted to the desired length of the graft harvest, using the graduated line numbers on the instrument as a reference for length. The suture in the bone plug is then pulled up 90 degrees from the femur to expose cross-linked tissues of the quad tendon, which are then cut with a scissor to free the graft segment from the tendon bed. At this stage, the bone plug can be quickly trimmed and measured using an ACL sizing block to ensure adequate size of the bone plug, which dictates the size of the blade that will be used for the harvester device, again, which range from 8 to 11 millimeters in diameter. Next, the passing suture that is in the bone plug is then threaded through the Cobra graft harvester device, and the bone plug is pulled into the graft harvester. With traction placed on the suture, the graft harvester is gradually advanced up the tendon until resistance is met. Then the harvester is rotated back and forth 45 degrees in each direction, and the cut is continued proximally until the desired length is reached, confirmed by looking through the graduated window on the instrument. After the harvester reaches the desired depth, the Cobra harvester is removed. Next, the passing suture is threaded through the cutting end of the quad saber graft extractor device and out the other side of the handle. With traction placed on the suture, the graft extractor is advanced up the tendon until the desired depth is achieved, which should be the same length that was used with the graft harvester device. Lastly, the outer handle of the graft extractor is rotated 180 degrees to amputate the proximal end of the quad tendon, completing the graft harvest. The graft is then pulled out of the non-cutting end of the graft harvester with the passing suture. The quadriceps tendon graft is prepped on the back table according to the surgeon's preference, and the ACL reconstruction is then performed.